Hello, everyone. My name is Chamutai Kebene, psychiatric nurse practitioner student at Colorado State University, Pueblo. And today I'm presenting acceptance and commitment therapy, ACT theory. Overview of ACT. Acceptance and commitment therapy, ACT, is a modern behavioral psychotherapy classified as a third wave cognitive behavioral therapy. Emphasizes psychological flexibility rather than symptoms elimination, helps individuals accept difficult thoughts and emotions, encourages individuals to act according to their personal values, integrate mindfulness, behavioral change, and acceptance strategies, frequently used in psychiatric and mental health treatment setting. Who developed ACT or invented ACT? Developer of ACT Stephen C. Hayes. Stephen C. Hayes is a clinical psychologist who developed ACT in the 1980s, professor of psychology at the University of Nevada, founder of contextual behavior science, conducted extensive research on language, cognitive, and psychological suffering. Personal experience with panic attack influenced his research direction. His aim to create a therapy that help individuals change their relationship with thoughts rather than trying to eliminate them. Biographical and cultural context. ACT developed during the late 20th centuries when psychology began emphasizing mindfulness and acceptance, influenced by behavioral psychology and relational frame theory. Integrate Western behavioral science and Eastern mindfulness traditions, reflects a shift from symptoms control toward improving a psychological flexibility, designed to address human suffering related to rigid thinking patterns, applicable across diverse population and cultural background. Major positive of ACT. The central principle of ACT is psychological flexibility. Psychological flexibility refers to the ability to remain present and aware of current experience, accept difficult thoughts and emotions without avoidance, as compared with CBT, cognitive behavioral therapy. For this one, you have to accept that you are in a difficult thoughts and emotion without avoidance instead of blocking the thoughts. Maintain behavior aligned with personal values. Adapt behavior in response to changing circumstances. Individuals often attempt to suppress distressing thoughts or feeling, but ACT proposes that avoidance increases psychological suffering. So for ACT, it uses what we call a hexaflex model. Um, is commonly illustrated using the Hesser-Flex model. The model includes six interconnected processes that promote psychological flexibility. First is acceptance. You have to accept that you are in a problem or you're in a difficult situation or thoughts. Number two, cognitive diffusion, being present or mindfulness, self as context, values, and committed action. This process help individuals respond more effectively to internal experiences. As you see the diagram over here, psychological flexibility and number one, like being present, um, present moment awareness. You have to be aware with the thoughts or the difficult moment. On the other side, acceptance, you have to accept the fusion that's creating space from thoughts and feelings, self as context, observing experience and not being caught up with them. And then you have to have values, you have to stick with your values, what matters to you, and your goals. Then committed action, you have to be committed, pursuing what is important to you. in this therapy. Acceptance. Acceptance refers to the willingness to experience thoughts and emotion without attempting to control or avoid them. Key aspects include recognizing emotion experiences without judgment, reducing experimental avoidance. You can avoid the difficult situation or the thoughts that you are having. Allow uncomfortable feeling to exist without suppression. This approach allows individual to focus energy on meaningful behaviors rather than struggling with internal experiences. Cognitive diffusion. Cognitive diffusion helps individuals change the way they relate to their thoughts. Thoughts are viewed thoughts are viewed as mental events rather than objective facts. Reduces the influence of negative thinking patterns. Encourage observing thoughts without automatically reacting. For example, instead of believing the thought I'm a failure as a person, a person may recognize it as a simple a thought rather than a reality. Mindfulness or being present. Mindfulness in ACT focuses on maintaining awareness of the present moment, encourages non judgmental observation of thoughts and feelings, help individual disengage from rumination about the past or future, promote emotional regulation and mental clarity. Mindfulness practices can include breathing exercise, grounding techniques, and guided awareness exercises. Self as context. Self as context refer to concept of observing self. Individuals learn that they are not defined by their thoughts or emotion. Create psychological distance from distressing experience. Promote perspective and self-awareness. This perspective help individuals recognize that thoughts and emotion are temporary and experiences rather than the permanent aspects of identity. Values. Values present the personal principle that guide meaningful life direction. Examples include family relationship, personal growth, health and well-being, spirituality, professional achievement. ACT therapy help individuals clarify these values and use them as a motivation for behavioral change. Committed action. Committed action involves taking behavioral steps aligned with personal values. Establish realistic goals, persisting in meaningful action despite emotional dis- discomfort. 11 key building patterns of behavior consistent with personal belief. This process encourages individuals to move toward valued life goals rather than avoiding difficult experience. Application of ACT. ACT has been successful applied to a wide range of psychological and medical conditions. Common applications include anxiety disorder, major depressive disorder, post-traumatic stress disorder or PTSD, substance use disorder, chronic pain condition, stress-related disorder. Research demonstrates improvement in emotional regulation and coping skills. Acceptance and application in psychiatric nursing. Acceptance and commitment therapy is highly relevant to advanced psychiatric and mental health nursing practice. Psychiatric nurses may use ACT to teach mindfulness and emotional awareness skills, help patients recognize and accept difficult emotions, encourage value driven behavioral change, support patients experiencing anxiety, depression, and trauma. ACT intervention promote patient empowerment and resilience. Research evidence. Extensive research support the effectiveness of ACT. Demonstrated effectiveness for anxiety, depression, and stress disorder. Studies show improved psychological flexibility. Evidence suggests improved quality of life and coping skills, increased integration in healthcare and mental health treatment program. Critique of ACT. Despite strong evidence, acceptance commitment therapy has some limitation. Some patients may find acceptance strategies difficult initially, require active patient participation and openness. Clinicians require special training to apply techniques effectively. However, many studies indicate strong long-term benefit for psychological well-being. Current status of ACT, acceptance and commitment therapy, continue to expand globally, recognized as evidence-based psychotherapy used in clinical psychology, psychiatry, and behavioral health settings, integrated into healthcare systems, schools, and community programs. Ongoing research continues to refine and expand its application. In conclusion, acceptance and commitment therapy emphasize acceptance, mindfulness, and value-based behavior. Key outcomes include increased psychological flexibility, improved coping with distressing thoughts and emotions, greater engagement in meaningful life activities. ACT presents an important therapeutic model for modern psychiatry practices. And below are my reference. Thank you so much for listening to me. Bye.